Hi there, we're back and we're talking in this video about testing hormones, who should test their hormones, and who should wait before they test their hormones because they may need a little special attention before they do so. So how to think about the zebra. So who should test their hormones? Should you? Yes, absolutely you should test your hormones unless, stay tuned. Almost everyone should test their hormones. If you're 35 years or older, you should test your hormones. If your periods are irregular, you should test your hormones regardless of your age. If your periods have stopped, you should test your hormones. If you have unexplained symptoms, you should test your hormones. It's that simple. It's that simple. Unless, though, you're listening to a conventional doctor and he tells you that you should get blood work to test your hormones. Listen to the experts, please. Anti-aging physicians' guidelines are saliva hormone testing for topical hormones because topical hormones are your safest way to supplement your hormone production. So don't let anyone confuse you. Do a saliva or blood spot test only. And I use a lab called ZRT Labs. They are very reliable. I've been using them for over 2 decades. So I use those labs on our website and for my patients. Now, I don't have any relationship with ZRT other than offering them on my website. Now, if you're using topical hormones, remember, say no to venous testing. So this is blood work out of the vein. Don't get venous blood regardless of what you hear or told because, some people say, well, my insurance covers it. It won't give you accurate results. So what good is blood results if you can't really use it to restore your hormones to youthful levels? Venous blood is not accurate for topical hormones, period. So again, I use ZRT Lab. There's a saliva test kit, and then there's a blood spot kit. Blood spot is taken with like a little finger prick, like a diabetic takes their blood sugar. They're super easy to do. You can do them in the privacy of your home. They're very affordable, almost always less expensive than blood work. Unfortunately, and I'm really bummed about this, they're not allowed in New York, California, or Maryland. Basically, those states want to keep the money in their own state, so you have to do saliva or blood spot testing with another company that comes out of your state. Now, California, you can actually do ZRT, but you have to get a prescription from your doctor in order to do it. Maryland and New York, they have been this way for many, many years. They will not allow the money to go outside their state. So who should not test? Okay, this is a very important feature, or not test yet. Anyone that uses pharmaceutical progestins needs special attention. So what is that? Combination estrogen and progestins come from pharmaceutical drugs. It's not a bioidentical. Progestin is not bioidentical. It's used to take the place of natural bioidentical progesterone. That's one of the big things I want you to stop using. And it comes in pills, patches, rings, IUDs, and shots. It comes in all sorts of these convenient ways through pharmaceutical companies. So this is one that many people know. They've heard about Premarin and Prempro. Well, Premarin is an estrogen only, and Prempro is estrogen and progestin. So Premarin, since it has just estrogen in it, you do not need to wait. You can do your tests as normal, but Pro needs special attention because it's got a progestin in it that needs a special attention. Now, you probably are saying, who uses Pro now? Well, not a lot of people. However, there's a lot of wolves in sheep clothing going on around there because all of these names here are just like Pro, very similar. They have an estrogen in them and a progestin in them. Activella, Angelique, Femheart, all of these, you see Pro down at the bottom, estrogen and a progestin. They're being used for menopause symptoms and osteoporosis. So there are also pills that have just estrogen only in the hormone replacement therapy, and doctors, some conventional, not anti-aging doctors, are still giving estrogen out without progestin or progesterone if a woman does not have a uterus, which you will learn makes no sense. In any event, if your estrogen hormone replacement therapy only has estrogen in it, you do not need to wait. Your tests will not be affected by that. Now, most brands of estrogen have been discontinued in the United States. We have these three now, Estrace, Minest, and Premarin, but there are lots of generics and they just look like that. This bottle here, they say estradiol on it. You do not need to wait. Go right ahead and test your hormones. Combination pills, oral pills, all oral contraceptive pills. There's one that's a progestin only pill, but all oral OCP, oral contraceptive pills, and HRT, hormone replacement therapy, need special attention because of the progestin in it, and it actually takes anywhere from 2 to 3 months to wean off of those medications if you want to do it symptom-free. And I have a step-by-step symptom-free weaning guide and videos on our website on how to do that. About 2 to 3 months, and it will get you off of those pills, and once you're off of them, you can test your hormones and get accurate results. Now, how about the patch? Well, the patches also have both progestin and estrogen in them. Some have just estrogen, but some also have both. So if it has progestin in it, you need to wait for about 4 to 7 days after your last patch. So when it comes time to change your patch, leave it off, and 4 to 7 days after that, you can test your hormones. Then there's the ring, has both estrogen and progestin in it. Same thing. You need to take the ring out of the vagina, and instead of replacing it at the scheduled time, you wait 4 to 7 days, and then you can test your hormones. How about the impregnated IUDs? There's 2 types of IUDs. One has no hormones in it. The other has a progestin in it. The progestin is going to interfere with your hormone testing, and that's what you want to get off of. You want to get off the progestin. So you need to have, unfortunately, you got to get that thing out before you can test if you want accurate results. So once you get it out, wait 4 to 7 days and then do your saliva or blood spot test. Now, there are also birth control shots, and there's some that's just progestin. This is the Depo-Provera, and it is a progestin, and it will affect your hormone levels. So you need to wait a week, skip whenever the next shot is due, and then a week after that, then you can test your hormones. There is actually no estrogen and progestin shot for birth control or hormone replacement therapy, but there is in Asia and Latin America, so it may be coming. Stay away from it. So, for symptom-free weaning and transition guides and videos are on the website. They're step-by-step. It's symptom-free. If it's a pill form that you're taking, That's the one that takes a long time, like 2 months or up to 3 months to wean off of it symptom-free. It's also going to help clean your liver from synthetic hormones, and you'll find it on the website. So, up next, which hormones should you actually test? And what does it cost? Next video, choosing the right ZRT kit. All right, take care. Bye-bye.